Hi, Arik Goel here, creator of the Goel Method and manual ligament therapy. If you remember my Roots of Chronic Pain video, and if you haven't watched it yet, I recommend you stop this video and go and watch that first before we continue. I talked a lot about how your stomach and your abdominal muscles affect the rest of your body, especially by producing pain on the back side of your body. Today I wanted to teach you how to start working with these points and contractions in your stomach directly. It's important that we start treating our stomach a lot more like a small child. And by that, I mean nurturing it. A lot of us have a very bad relationship with our stomach. Maybe you don't like the way it looks, maybe you don't like the way it functions, the way it feels, but we have to do the opposite. We have to give it a lot of positive thought. The stomach is considered the second brain of the body. It's loaded with nerve endings, loaded with different receptors, and there's a big nerve that connects your brain directly to your abdomen called the vagus nerve. So all day long, all night long, there's emotions, there's stimulus going back and forth, up and down, and it's really important that we do things to our stomach to help it calm down and relax, especially if we're stuck in that stressful kind of mode, the sympathetic mode, a lot of our life. So I'll be teaching you how to use your hands to work on these points. I'll be teaching you how to use a small tool like a trigger point tool to work on these points as well. But the most important thing is to start on a daily basis taking care of your stomach, especially in the morning or in the afternoon, before you do exercise, before you do stretching, like especially the stretches that I'll be teaching you in my other videos. And it's time to create a different relationship with your stomach altogether because it's that important. So next, we're going to get into how to work on the knots in your stomach. It's important that you know that this video and other videos related to the Goel Method/Goel program are not meant to cure you of your chronic pain. They're merely a sampling of what's included in the Goel program. Now, if you want to learn more about the program and exactly what it includes, please feel free to contact me through the website goelmethod.com. In the meantime, these videos are great for helping you understand your body in a different way and hopefully give you some ways to reduce your pain and discomfort, if not more. However, if any of the protocols create pain, if they make you feel like something's just not right, please stop doing them immediately. Now, your chances of getting hurt are pretty low, but let's err on the side of caution, okay? In the meantime, please enjoy the video. I'm Arik Goel, and thanks for watching.
This is a tutorial for working your abdominal area with an abdominal massage, otherwise known as self-myofascial release. I've applied a rice bag for about 10 to 15 minutes. It was in the microwave for about 2 minutes. What this does is it helps to get the tissues nice and warm so I can get deeper into them and work on the knots. Here I'm showing you where we're going to begin, which is the lower left side of my abdomen. And you'll be working your way up to the left side of the ribs and then beginning again from the lower right side, working your way up to the right side of the ribs. I'm outlining the rectus abdominis. This is the tissue that we're focusing on. It's also known as the six-pack. It goes from the pubic base all the way up to where it attaches to the ribs. So now with the actual procedure, I'm beginning on the lower left-hand side, depressing my fingers about 1.5 inches, 2 inches into the tissues. Looking for areas that give me some kind of a pain, some kind of a feeling of tightness, a knot maybe. And I'm doing zigzags, I'm doing circles, lines back and forth, just working different angles of the knots that I find. After about a minute, I move up a little bit, maybe about 1 inch or 2 inches up, and I look for other areas. You're looking especially for areas that give you different sensations. That might refer sensations to your back, up into your chest, even your head, maybe your toes. And then once you get to the top, you want to get into working underneath the rib cage. And don't worry, you're not going to hurt yourself, especially not when you're using your fingers. But you do want to make sure that you get this tissue softened up because when your upper abs are tight, it makes it difficult to breathe properly. So as I'm doing this massage, I'm taking nice deep breaths to help in releasing those tight muscles. So, working on the left side, spending a good couple minutes up there, checking for different knots, working on the right side. And then going back down to the right lower half. And once again, I'll be looking for different knots in the tissues, and especially the areas that send sensations to other parts of your body. You're not going deep enough to hurt your organs, so don't worry about that. This is all soft tissue work. So here I am using a trigger point tool that has a dull end and a sharp end. The sharp end is one that you will not be using. I recommend using this once you've gotten more experience in using your hands, because I do want you to build some sense of sensibility in your hands so that you know how your tissues respond. I'm doing the same kind of pattern, starting from the left lower side, doing circles, zigzags, lines, looking for tender areas. Now we're going to begin working with the iliacus, which is a deep hip flexor muscle. This muscle is indicated especially when you have lower back pain, sciatic pain, or that's deep kind of gluteal pain. Unfortunately, it's a neglected area. You can use your hands, you can use a trigger point tool, but it is much easier to use a trigger point tool to get in there. Getting into more detail, first we find that bone at the top of your hip, and you drop just below it, and you go a little bit to the side. You're going to aim at an angle. You're not going to go directly straight down, but you're going to go more towards your hip, more towards the outside of your hip. You're looking for, again, those types of knots that give you sensations in other parts of your body, especially lower back or maybe your diaphragm, areas that are warm, areas that might give you like a sharp sensation. Don't worry about injuring yourself. You want to actually look for those areas that give you that kind of sensation. Just don't press too hard, obviously. You'll probably find 2 or 3 good knots in there. So it's going to take about a minute or 2 to work through it. And then you're going to switch to the other side and repeat the process. In total, working on your abdomen and the iliacus probably will take you about 15 minutes or so. And I do recommend it every day.